Hello, my name is Dr. Brian Raid, and I'm a naturopathic doctor. And this is a video in response to a question somebody posted on one of my other, asked in response to one of my other videos. Well, actually, I'll just read the question out. That's probably easier that way. So the question is, can the presence of normal background levels of a given mycotoxin be enough to wreak havoc on someone's system and warrant treatment? And then in this particular case, the person's also tested positive for Marcons, which is a specific type of bacterial infection in the nose that can coexist with mold issues. So as per usual, nothing that I say should be construed as any type of medical advice whatsoever. Please talk to your personal healthcare provider to get any treatment advice about your particular case. But just as for information's sake, it's a really good question. So I believe, if I'm understanding the question correctly, if a person did a mycotoxin test, so like a urine mycotoxin test, which is mentioned in the text of the question here that this was done, and the results came back showing that there's which I'll take a step backwards. So with urine mycotoxin testing, there's a reference range. Ideally, nobody should have any mycotoxins in their bodies at all, but if the level is below a certain value, then it's generally considered to be in a probably non-problematic range. So for ochratoxin, I'm trying to remember off the top of my head, I think that if it's less than a 7.5 or something like that, or less than a 5, then that's considered to be probably non-problematic. Anything above, we'll say it's a 7.5, would be considered to be problematic. So like an 80 would be like, whoa, that's a lot of ochratoxin. You probably have may have a notable issue with aspergillus, which is the mold species that produces ochratoxin A. Or a 20, it's like, oh, it's elevated, not crazy high, but maybe enough to be making you sick anyways. So I think the question is, if somebody has just quote unquote normal background levels of a mycotoxin like ochratoxin, so let's say if the reference range again is supposed to be less than 7.5 and the person comes back at a 3, it's like, okay, that's in a normal reference range, probably not problematic, but could it actually be a problem for someone, and especially if they had this concomitant issue with Marcons? So it certainly could for a given patient. The challenging thing is we wouldn't really have a way of definitively knowing if that was the case, at least not before treating the person. So if I had a patient and they had the exact same scenario, and I recommended a treatment protocol for mold and they got better, then I would assume, well, they're probably feeling better because it's addressing that background level of mold. And if they didn't feel better, then that background level of mold probably wasn't a factor. I think that unless a person was really, really depleted or really, really sensitive, that background level of mold probably wouldn't have a great chance of causing a actual mold toxicity issue, like where there's just too many mold toxins and it's overwhelming the detox systems and it's causing a bunch of issues. However, if that person was really sensitive or allergic to mold, those background issues could potentially create enough of an inflammatory quagmire in their body that it could really set the stage for something else like Marcons to cause a lot more of an issue than it might have if the background mold wasn't there. So it's a really good question. I would say that by and large, when I run urine mycotoxin tests on patients and I see that their level of mycotoxins is within the acceptable range, I usually don't think to myself, like, this is something that we're going to want to treat necessarily. However, depending on the circumstances, the nuances, if the patient said, yeah, like anytime I'm around mold, I really just have crazy allergy symptoms and whatnot, or I feel just awful whenever I go to my, in-laws' place or my church or whatever place it happens to be that has, mold issue, then I would certainly look at it through that lens and think, okay, maybe this background level is actually problematic and we're going to want to treat it. One of the nice things with mold treatment is that the treatment, at least the way that I treat mold, it doesn't, it's relatively inexpensive. Depending on how we go, it can be just downright cheap. And it's generally speaking quite well tolerated and non-invasive. So if we got results back, the results are, kind of borderline or they're in the normal, so acceptable limit, then, it's like, depending on the scenario, it might not be a bad idea just to do a therapeutic trial for a month and just see if there's an improvement. But again, it would really depend on the specifics. So it's a very good question, and I hope that answers the question. If anybody has any further questions on this topic or about anything else, just post them in the comment section below, and I'll do my best to answer them if I can.